Namaste, guys. Can we get started? I think we should. Looks like most of you are back. Okay, so we are going to continue our lessons on srotas. Okay, that is srotamsi, our plural. Srotas is what we're going to keep referring to. Okay, srotas. So we did. Anybody remember which srotas we did last week? What channel did we see last week? What channel system we saw last week? Raktavaha, very good. Okay, because this class can get quite bland and boring and kind of frankly, just like, you can zone out. So you really absolutely have to participate. This is like, you have to keep going through this over and over again. So any chance you get to kind of jog your memory and challenge your memory a little bit, yeah, you need to absolutely participate. Okay, otherwise it's going to get sound very repetitive and very like, you don't get a good grip on it. Okay, so those of you who have done the AC 105 already, one half of today's class, who was here, I'm sure you've already done the dhatus, the Rakta Dhatu and so on, right? So this is again the Raktavaha srotas. Rakta is blood, according to us. Like now, us means there is the regular English understanding of blood, and then there is the Ayurvedic understanding of blood. Remember, we went through this with the Raktavaha last time. So what exactly is rasa? Okay, is it plasma? We had this discussion last time, right? Like that. This is about Rakta. Okay. Rakta, let us understand for just in our English regular normal terminology. Using that, we'll understand what we mean by the Rakta. The Rakta is, think of it as just the red blood cell component. Okay, for us to get a good, quick, to the point understanding. So the blood is flowing, like you're supposing, somebody's drawing your blood from your veins, or, you get a cut and you see blood coming out. There's a lot of components in that blood, right? But what is the component that gives it that red color? Because when you say blood, what is the first thing you think of? It's color, right? So what is the component in blood, as far as our Western knowledge or English knowledge of, yes, that's the red blood cells, right? So think of it. So Rakta, blood means that red. So what is the red color giving component? That's our red blood cells. So think of it like that. So in the blood, like when I said, when somebody makes a cut or, somebody's taking a drop of blood for, I don't know, checking your blood sugars, you get a drop of blood out. So there's a lot of other components in that one drop other than just red blood cells. But the red blood cells have that hemoglobin in them, which have the color. Okay, the heme part has that color. So the most prominent quality of blood that we notice is red color. Okay, and what does it do? It stains. So that's because we know it has that coloration to it. Now there's different synonyms for a Rakta. So why is this even here? This is here because, like, for example, Shonita is sometimes, you'll see that if you're reading other than what, printouts or slideshows or whatever we share with you, if you're reading other sources of material, you may come across these other terms. That's why it is here. So Shonita, you will see a lot. You may see a lot. Astrok also, you may see a lot. So these are just there because, oh, I know Rakta, but then these can also be used in the context of Rakta. Okay. And how much Rakta is there? Rakta Dhatu, this is okay. How much Rakta is there in our blood? 8 Anjali. So what is 1 Anjali? Anybody can remember? I'm sure you studied this, especially the class that is the 1121. You know what's Anjali? How much is, yeah, that's Anguli. That's when we are measuring our marmas and things like that. This is Anjali. Yeah, it's more so like if you put both your palms together, like to make a bowl-like thing, how much ever is contained in that. Okay, so 8 Anjalis, 8 such Anjalis is the amount of Rakta Dhatu that is there. Now, if you ask Western medicine, how much blood is there, so that is different. So that it's kind of like that because, how much you have to quantify it. So in Western medicine also we quantify it. In Ayurveda also we quantify. So in Ayurveda, we quantify not only how much blood is there, lot of dhatus are quantified. Okay, as you study each dhatu, they actually knew way back then, like how much of this dhatu is there in the normal body. And why did they know that? Because they could know when the dhatu was too much or too little, right? When there is excess dhatu as well as less than what should be there. Okay, so they knew the normal level, and then they knew the abnormal levels, and then they knew how to look for those, whether it's too high, whether it's too low, and that they did by by the prashnam, dashnam, sparshnam, and all that. Like, how you ask the questions and you examine the client and you figure out whether the dhatu is more or less. But they knew the normal level. That was what I was trying to emphasize. Okay, like I said, Rakta Dhatu is analogous, is blood. Let's like the red part of blood. So that's why I don't want to keep going round and round. So we just need that one point that makes us understand. Okay. So these are some characteristics of Rakta Dhatu, which you will study over and over again. So don't get too hung up here. This is the point I would really like to make. What is the main Mahabhuta that's there in Rakta Dhatu? Now, why do you need this? I'll tell you in a second. So Rakta Dhatu is predominantly fire element and water element. Okay. So what else do you know that is made up of fire and water? When you think of a combination of fire and water element, Pitta, exactly. Is that connection coming? Yes, yes. What is Pitta dosha? It is combination of fire and water. So Rakta Dhatu, Raktavaha, srotas, anything to do with Rakta is very, very intimately related to Pitta because of this, because of the Mahabhuta thing. And why do you need this? Because, for example, just rewind and go to last week. What was the Mahabhuta composition of Rasa Dhatu? I mentioned that last class, but can you remember? I don't expect you to, but what was the main Mahabhuta in Rasa Dhatu? It was actually the water element. Okay. So as we go, just try to keep these little things in your mind, because this will help you understand the dhatu, therefore understand management. Okay. So now that we've come here, the Rakta Dhatu is very closely linked, or it's got very close similarities or attachments to our Pitta dosha. Okay. So Rakta Dhatu is one of those 7 dhatus, is the only actually dhatu out of the 7 that's greatly associated with Pitta. Most of the dhatus will be very closely associated with Kapha. Okay, that's like, except Rakta Dhatu, which is Pitta, and Asti Dhatu that has a relationship with Vata. So I mentioned this previous class. I will repeat this every class so that it will kind of stick in your head. So Rakta Dhatu is one dhatu which is very closely linked with Pitta. Okay, so why am I saying that over and over? Because when we have to kind of tackle Rakta Dhatu or Raktavaha srotas, Pitta is something you have to kind of keep in mind and tackle side by side. Okay, now every dhatu is affected by all 3 doshas. Can be affected, can be aggravated, vitiated, whatever. Okay, doesn't mean, oh, if Rasa Dhatu is linked closely with Kapha, then does Kapha, only Kapha imbalances will affect that dhatu? No. Okay, I'm pretty much expecting somebody to ask that question. That's why I'm bringing it up myself. No, not like that. Any dhatu, any srotas, any type of channel can be influenced or imbalanced by any of the 3 doshas. Okay, that's a given. But if there is a special affinity that we know of, which we do now, like for Rakta, it's Pitta, then anything that's happening to Rakta Dhatu is going to affect Pitta. And similarly, anything happening in the Pitta dosha is going to affect the Rakta. So that's just the extra special relationship. Doesn't mean that Rakta Dhatu will never be affected by Vata or by Kapha. Okay. So keep that in mind, but the association is there. So from there, sometimes, you can kind of join the dots. For example, if your mind goes completely blank, okay, and you're thinking, okay, there is some kind of Rakta Dhatu issue going on and you can't remember anything. At least if you remember, I'm going to tackle it like I will tackle Pitta dosha, which you will obviously remember some baseline guidelines, some basic stuff. That's, from way back. So you'll remember Pitta dosha and how to manage Pitta dosha. So if everything deserts you in that moment, be it in a test, in a quiz or wherever, how to manage Rakta Dhatu. If you know that it is kind of sort of attached to Pitta closely, if you can recollect how you'll deal with Pitta dosha, right? Then you may be able to use some of those points and extrapolate it here, and by and large, it will be okay. That's what I'm trying to say. Did you guys understand? Did you understand what I just said? Do you want me to repeat it? Because I will. Yes, I haven't addressed this slide. Okay, I was still talking about the previous slide. Okay. So yes, so keep that in mind. That's just a little shortcut. So now these are the functions of Rakta Dhatu. Now keep in mind, all of you, especially the new group, you will have class on Rakta Dhatu separately. Okay, that will also be happening for you. Okay, so keep in mind. So don't try to stuff all information just with this one class today. Okay, so these are the main functions of Rakta Dhatu. It gives life. What does it mean? It gives life. It means it's kind of, if you had a major injury to a blood vessel, okay, all your blood will come out, you'll die. Okay, so that's one way to interpret that. Okay, the other thing is, it's what it transports, it circulates our prana, right? So it brings that life-giving force to each and every part of our body. So it actually brings life force itself to every part of our body. Okay, so and it contains life itself, because if you lose it, if you lose the blood, then you die. So there's that way of looking at it too, but it actually brings life to every part of our body. Okay, then it has the color, it has that like we mentioned earlier, so it brings that luster, the shine to the skin, actually even the color to the skin in some ways. Okay, how you think of people with rosy cheeks, that rosiness is our Rakta Dhatu. Okay, then I said it it helps circulate our prana. Now this we can go as in-depth as we want, but just for us to kind of quickly understand and remember, the red blood cells, which is our Rakta Dhatu, what do they do when they're in the lungs? All the oxygen is taken into these cells, and then these cells circulate. And wherever they go there. And then these red blood cells release the oxygen that they're carrying, and they give it to, I don't know, your muscles that are working. It gives that oxygen to your heart, which is pumping. It gives the oxygen to the kidneys that need to work. So it literally transports that oxygen. Now, keep in mind, oxygen is not equal to prana. Prana is not equal to oxygen. They're not synonyms that can be used interchangeably. Prana is a lot more than oxygen. But I'm just giving a easy to understand existing example. Okay, so that's a literal way of understanding. Okay? So, but then the whole circulation of prana is taking place through the circulation of our Rakta Dhatu. Now, obviously helps in nutrition because it carries part of our nutrition. Both Rasa and Rakta do that. Okay, not just Rakta Dhatu. Rasa Dhatu also does that. Okay, so Rasa and Rakta will help in circulating that nutrition that the digestion has brought about. Then it goes and nourishes the each and every part of our body. Okay, now we have to think. Yes, we will. There's one more place where we understand that which are the specific sub-doshas that are connected to each dhatu. For example, what gives color to our skin and color to our blood itself? That's our Ranjaka Pitta, right? So that is there. So every sub-dosha, we will see which are the ones that play a major role with which dhatu. So that connection also we have to learn. Okay, yes, you're right. Okay, for any circulating, the Vyana is there. And not only that, see, the Vyana helps circulate the Rasa Dhatu, circulate the Rakta Dhatu. Okay, but through the Rakta Dhatu, that Vyana is also getting circulated. Do you see? They kind of, most things you will realize. I mean, when you start out, you want to understand A, then you understand B. But as you go along and you start understanding more and more, you realize that A is kind of helping B, and then B is also helping A. So it kind of, yes. So, they kind of support each other. So most of the times you will, as your understanding deepens, you will make more connections. Okay. So again, so when our Rakta flows and it flows to, your, let's say under your skin, right? The actual sensation of touch, for us to help perceive that sensation, because sensation of touch is perceived through the receptors that are there in our skin layer. Okay, so if those have to be nourished, let's say. Okay, so for those to be nourished, for those to be maintained, our Rakta Dhatu is very essential. Okay, and not only that, the Rakta Dhatu is what brings our temperature sensation. Okay, so that also is brought about by our Rakta Dhatu. Because remember when one of the things that, even common people will tell you, I mean, especially in India and in other cultures, will tell you, like, if you're feeling very cold, or if you're feeling like, sometimes your feet are very cold, my hands are very cold. Just regular people will tell you, you have low blood. Has anybody heard this? Yeah, you have low blood. I don't know what low blood means, but or they'll say you have less blood in whatever vernacular language. There is always a term for that. And sometimes here, the Western world, they'll just say you have poor circulation, right? Yes, poor circulation, right? So without that Rakta Dhatu coming in right till your fingertips and Rakta Dhatu being adequate, that warmth doesn't come there to that part. And we have experienced this ourselves, right? So we have to either rub our hands and bring back our circulation or something like that. So here it's the Rakta Dhatu, all the Rakta and Rasa are circulating and coming to your hands or legs or whatever. Of the two, it's the Rakta that brings that warmth. Okay. I'm sure we've heard to, like, hot-blooded. You've heard the term, somebody is very hot-headed, hot-blooded, that's our excess, that's our Rakta Dhatu. Okay. So of course we all know this. I mean, I wouldn't say we all know this. People who have done the AC 105 already, they know this. So what does Rakta do? It also, a certain portion of the Rakta then goes on to nourish and to support the next Dhatu. Okay. So from our food, we got the ahara rasa, the extract, the nutrient extract of the food. From that, the first Dhatu was formed, which was rasa. Portion of it only became rasa. A certain portion of it, of that rasa dhatu, becomes the next dhatu, which is our rakta. Similarly, Rakta Dhatu has formed, it's matured, it has become proper adult Rakta Dhatu. But some portion of that Rakta Dhatu will be, assigned to become the next dhatu. The next dhatu after Rakta Dhatu is the Mamsa Dhatu. For those who are the newer group, the 322 group, is this too confusing? Feel free to say. So no, because you're going to learn it again, I'm pretty sure. Okay. So it's kind of very beautiful. It's like a cascade. Think of it as a cascade. Think of it as like those multiple chemical reactions that you might have studied in high school. So step 1, step 2, step 3, like that. Okay. So again, so if you have to have good Mamsa Dhatu, your Rakta Dhatu should have been good. And if you had to have good Rakta Dhatu, the Rasa Dhatu before that should have been good. Okay. So because from one, you form the next one. So no exception here. So Rakta Dhatu will give rise to our Mamsa Dhatu. So that is also a function of the Rakta to form Mamsa. Okay. The Mamsa Dhatu is muscle in case. Okay. So the Mamsa is muscle. Okay. So next, okay, we'll just say, like, remember last time too, this is how we approached the Raktavaha srotas. Okay. So for the Raktavaha srotas, okay, we saw the origin. That's where does this channel system start? Because think back about it. We are thinking about a whole channel distribution system, that river picture I showed you. So the river has to originate somewhere, right? In the mountains, in the glaciers, somewhere. So the origin, the root of that river. And then the river flows, that's its pathway. It winds to many states, whatever. And then in the end, it goes and opens somewhere, right? It goes and opens out into the sea or a gulf or a bay or whatever. So it's similar to that, okay? So where does the Raktavaha srotas originate? Where does this channel, this network originate? It originates in the liver and spleen. Sorry, there's a D missing. Liver and spleen. So these two are the roots. Okay, so there are two roots. Okay, liver and spleen. So this entire, we can, for want of a better word, we'll just call it circulatory system. This entire circulatory Raktavaha srota system originates from the liver and the spleen. Okay. And what are its pathways? Its pathways are the arterial systems. Let's just to make, this is for us to understand and make easy, okay? All the arteries, because there is a lot of discussion about what is the artery, what is the vein, what is the capillary in terms of Ayurveda. In terms of Western medicine, it's very clear. So in terms of Ayurveda, sometimes in different articles, different journals, whatever you read, textbooks, there's a lot of overlap because the terminology is different. So just to simplify, and this is highly oversimplified, so that we may understand something at least. Those discussions are for higher level experts, okay? So let's think of this as the arterial system. Okay, that's your arteries that carry the so-called pure blood, the oxygenated blood in Western medicine. Okay, whereas the Raktavaha we saw, that also includes the pulsating arteries, but it was more about the veins, the capillaries, and all that stuff. So, and because Raktavaha has got a lot more, like it's got lymphatics and all those circulation of all that also. Okay, so here when you think Rakta, just think of the arteries for now. Okay, and where does this artery go and open? This arterial system, where does it go and open? In the body, the arterial system connects back into the veins. Okay, so there is junctions there. So think of all those little junctions. Okay, so that is it. So, but the most important thing you should know about this whole structure is that the Raktavaha srotas originate in the liver and spleen. This is what you should absolutely know. Okay, you don't have to get into all the other, these two distinctions and sub-distinctions. Liver, spleen. This is the most important thing for you to keep in mind. If the others are not so, if you're confused about that, it's okay. This is very important. Now, why is it important? Because most of the times, as you will see in later slides, any disease of the liver or spleen will have a major impact on the Raktavaha srotas. And similarly, if there is something going on or something has imbalanced the Raktavaha srotas, sooner or later, it will affect the liver and spleen. And these are important organs, especially the liver. You can live without the spleen. You cannot live without the liver. Okay. So it's a two-way street. As I was saying earlier, most things are two-way streets. For ease of understanding, to start off with, we study it as a one-way, but then one will affect the other and vice versa. Okay. So remember, even last time we studied, and this you will again study it more formally. There are sometimes the dhatus have something called upadhatus or accessory tissues. Okay, the Rakta Dhatu itself is a tissue. It has two upadhatus or accessory tissues or additional tissues. And every dhatu, not every dhatu, most dhatus will also have a mala. Mala means waste. Okay, because like any system that is working will generate some waste. Okay, so that's like a byproduct. So you can look at it like that. So it's not waste like in terms of like things that have to be looked down upon. In the body, even the waste serves a purpose. Only thing, eventually it has to be thrown out. But in that process, it still serves, does some good in that process. Okay. So the two upadhatus of Rakta Dhatu are Sira and Kandara. Sira are blood vessels themselves. Okay. And Kandara are sometimes called tendons, but these are little bit slightly bigger tendons. Some places they also think of them as fascia, which are like thin layers. So basically think of tendons as tissue that attaches the muscle to the bone. Like, how you have the Achilles tendon at the back of your ankle. If you touch the back of your ankle, you feel like a hard cord. Can you feel that? Like if you touch the back of your ankle. Do you feel a cord-like thing that's hard? Anyone? Yeah, that's your Achilles tendon. So that's a tendon. That's not a muscle. That's not a bone. So that's your entire calf muscle, the bulk of your calf. It comes down. That's all muscle. But when you touch that calf area, the bulky part, that's muscle. But as you follow it down, that muscle ends and it becomes this cord-like structure. And then that cord-like structure is what is attached to the heel bone that's there, right? So that in between that bone of your heel and the chunky muscle of your calf, that cord-like structure, that's the tendon. That's usually the end portion of your muscle. It's no longer muscle at that point. It becomes that cord-like tendon that goes and attaches to the bone. Those tendons are almost like pulleys, okay? because the working of muscles in our body is pure mechanics, almost like, you can really see the physics behind it. So it's like a pulley system. Okay. So those are tough little things, those tendons. Okay. So according to Ayurveda, those are sub tissues or accessory tissues to Rakta Dhatu. Okay. So what that means is if things are kind of going wonky in your Rakta Dhatu, you can see its effects in the tendons and the blood vessels themselves also. Okay. So because they all are part of the same package, if you want to look at it like that. And the mala of Rakta Dhatu is actually pitta. Now, this is not our vata, pitta, kapha, the three doshas pitta, but this is called poshaka pitta, which is basically a substance, if you want to call it, that will nourish. So it's mala, it's waste, okay, but still it kind of nourishes the entire Rakta Dhatu itself also. Okay, that's the beauty of it. So for our Rasa Dhatu, if you remember, you may not, the mala there was, can anybody remember? I'm putting it in the chat. Okay. For the Rasa Dhatu, the mala was actually kapha itself. Poshaka kapha, they're called. Okay. This is Poshaka pitta. So the mala itself is pitta, which, what does it do? It's waste. It's not needed for the system, but it actually does a little job before it goes. Okay, which is so nice. Okay, this is what's, some explanation about the sira. Okay, sira are blood vessels, which we know. Okay, and this was described by Sushruta. He described it as like, if you look at a leaf, you see the veins in the leaf, that pattern, right? It's like branches, sub branches, and so on. And then the branch, the small lines that you see. So it's kind of like that, a network. Okay, and it is the network is believed to originate from our belly button. Okay, all our blood vessels, the sira, are supposed to originate the syrup, from our belly button. Okay, and there are different types of blood vessels. Okay, this is what is described. Don't ask me to give an equivalent in Western medicine. I can't. Okay, so that's what sometimes I can give certain parallels which will make us understand. Sometimes there isn't any. So that's why over and over, Manjulaliji had to remind me, don't do that. Don't do that, because you won't. You'll get stuck. But I can't help myself. Sometimes it works, sometimes it doesn't. Okay, so this is one of those times when I can't give you a parallel. Okay, so there are 4 types of blood vessels. Okay, according to, this is again Sushruta. Okay, so some carry the vata dosha, some carry pitta dosha, some carry kapha dosha, and then some carry the rakta itself. Okay, so this is just a classification of the different types of blood vessels. Okay, based on what dosha they carry. Now, if you say, oh, if you isolate this a blood vessel in the body, and if you dissect it, how do you know there's vata dosha inside? You don't, because that's again our modern scientific way of thinking, that you should cut open something and dissect it, and then you will see it with your own eyes or with a microscope, and that's how you know it exists, right? That's the current scientific thinking, but it's not that kind of thinking. So you have to keep in mind. Okay, that's why it will not match up. But you can when you look at your own forearm or inner side of your forearm, some vessels do look bluish, some vessels do look more bright red, some vessels do look a bit pale in color. Okay, so a little bit of it you can understand, but quite literally, if you want to understand point by point and try to match up, it will not match. Okay, so the types of blood vessels, like one for each dosha, and then rakta. Now I'm sure you studied when you were in your AC 101 and things like that, like, because Sushruta also considered rakta as a dosha. I'm sure you did an assignment where you had to explain whether rakta was actually a dosha or not. How many doshas are there? We now will always say vata, pitta, kapha, but Sushruta believed rakta was also a dosha. Okay, I'm sure this will kind of ring some distant bells in your memory. Does it ring any bells for anybody? It should. I'm sure you did that assignment. I've done it when I was a counselor. Anybody recollect whether Rakta is a dosha or not discussion, that discussion assignment? Everybody is silent. Okay, I'll take that to mean that you don't. Yeah, okay, you don't recollect. Okay, maybe it's not there as an assignment anymore. Okay. So because typically we think of three doshas, vata, pitta, kapha. Okay. But Shushtadatha believed there were four doshas, vata, pitta, kapha, and rakta. So he thought of rakta also as a dosha. Okay. That's where this probably is coming from. I don't know, but I'm guessing that's where this is coming from. Okay, moving on. Okay, now we are moving on to the actual Raktavaha srotas. Okay, srotas. Okay. So again, this is repeat. Liver and spleen are the principal organs in this entire system, in this entire circulatory blood carrying system. What are the two important organs? It's already there. Liver and spleen. Okay, liver is called yakrit and spleen is called pliha. Okay. Now, if you ask, oh, somebody, somebody had an accident or something, and you would have heard that they will operate because the spleen starts bleeding and then they remove the spleen. So in them, what happens to the Raktavaha srotas? Yes, you can live perfectly well without the spleen. It'll have some small issues, but you're not going to die without your spleen. But it does cause some issues. And there I feel the similarity I can see because it interferes with your immunity. It interferes with your quality of the blood itself, because spleen actually, another word for spleen is like that's the graveyard for all your imperfect or misshapen blood cells. Okay, when your red blood cells, since we're talking about Rakta, when they're past their lifetime, they live for about 120 days. Okay, so at the end of their lifespan, they have to die. They have to be broken down. Where do they go to die? They go to the spleen. Okay, so without that spleen, they will still be destroyed and taken care of. But an important component goes missing now. Okay, so it will affect the quality of the blood. So even in Western medicine, it will. You won't die, but it is, it does have its effects. Okay, so for if you want to approach this channel, this Raktavaha channel, this Raktavaha srotas, this circulatory system channel, right? There are some marmas that are associated with this. Again, some of you might have finished the marma elective. Have all of you here done the marma elective? Because somebody mentioned the Anguli. So yeah, all of you have done both the classes. I know there are two groups here. Okay, perfect. So then you know all these marmas. You know the heart marma, the nabi marma, the kurpara. This is the elbow. So on your right elbow, it is more for your, if you work on that kurpara, right kurpara, you're working more on the liver. If you work on your left elbow, the left kurpara, you're kind of targeting more the spleen. Okay, the spleen is on the left side, liver is on the right side. But by and large, that's just a side distinction. Then Brihati. Anybody remembers where Brihati marma is? It's in your back. Okay. This is Jano is your knee. Again, the right knee, left knee. Okay. And then Lohitaksha. Anybody remember where Lohitaksha is? That's in the upper limb and lower limb. So they are kind of where that limb comes and attaches to the trunk. Like in the upper limb, it's kind of where the axilla is. Okay, somewhere in there. I'm just giving a very vague, just the general area. You know where that is, as opposed to, is it on my tummy? No, it's not on your tummy. It's in the upper limb. It's where the axilla is there. And then similarly, kind of very close up to your groin, where your leg thigh comes and attaches to your body, right? Up in that area. So you can go look it up just to let you know where is Lohitaksha, just to get an idea. Is it in my foot? No, it's not in your foot. It's more higher up here, where the thigh comes and attaches to your body area. Okay, Siramatrika, this is on your neck, along your carotids. Okay? So the point being, these are the marmas you can work on if you are trying to deal with or balance the Raktavaha srotas. Because like by now, when you do a protocol for anything, you have your ahara, you have your vihara. And part of that, you can also have other, you can have a spiritual way of, you can you can prescribe spiritual protocols. You can prescribe, marma therapy. So like that, so, you can prescribe japas. There's many other things. There's not just the herbs, the ahara, just not those. There is addition. So this is kind of giving you the marma therapy approach. Okay. So these are just, again, you've done this already. So the heart marma, it's not just for your Raktavaha srotas alone. For Rasavaha srotas, you can also use it for Manovaha srotas, so on. Okay. So, but the thing with these are very delicate marmas. Okay, so you have the Hridya marma especially. Also the Siramatrika, the ones I told you along the side of the neck. You don't want to be too vigorous in their massage and things like that. So you need to be a little bit delicate there. Okay. Just like I said, the Siramatrika also very sensitive, very delicate. If you go in there heavy-handed, sometimes the person can actually pass out. Okay, along the sides of the neck. So be careful. And certainly don't try to work on them if they're sitting up. You want them lying down. And Nabi marma too. Okay, so because remember, all the blood vessels were originating from the Nabi, and they were going like, remember, like a network, like that you see in the leaf. So Nabi marma. Okay, well, let's go. This is where earlier one of you were mentioning, right? Which are the doshas that kind of work with the Raktavaha srotas? Okay, from the vata dosha side, which are the sub-doshas that work? Now keep in mind, eventually in some way, shape or form, all sub-doshas can be connected to each other and to each dosha and to each dhatu. So, but we are trying to pick out which are the important ones. Okay, so for our Raktavaha srotas, the important ones are the Vyana, Prana, and Udana. Okay, more important, quite literally, will be Vyana because it's circulating. Remember, that's what you asked in the chat, right? So for rasa also it's important because if it has to circulate, then you need vata. And which sub-dosha of vata? Vyana. But the prana is also extremely important, because that prana is, that's circulating through the rakta. So it's not a big leap of faith. You're just connecting the dots. And udana too, because this has to keep the balance. This has to put the things that need to be downwards, right? Because it's part of circulation, because it's not just Vyana is circulating, it is circulating, but the Udana also has to kind of balance itself, right? Because then it can otherwise mess with which is going up, which is going down, and so on. So again, think about it. This is Rakta Vashrotas. Pitta is very important. The very color of our Rakta is Ranjaka Pitta, okay? And it circulates our food. The Pachaka Pitta also is there, okay? So, and whenever there's Pitta, the connection to Agni will also follow. Okay, so be it at the Dhatu level, not just our Jata Agni, but at every cell level, the Agni that's burning. Okay. Next is Kapha. So your Avalambaka Kapha, your Bodhaka Kapha, Kledaka Kapha. These are the Kapha sub-doshas that are involved with Rakta that we have to keep reminding ourselves. What are we studying? Rakta Dhatu. Now, these are the causes of vitiation, causes of imbalance, causes of corruption, however you want to understand vitiation in your head. Okay. So what are the causes? These are some of the causes that are well listed. Okay. Intake of any kind of food or drink, which is irritant, meaning what is irritant? Nobody will go take and eat something that's irritant, right? But what it means is anything that causes like a burning sensation in your chest when you eat it, like if you're eating peppers, yeah, exactly, right? So anything that after you drink it or eat it, if it kind of gives you that burning sensation in your chest, okay? So those kind of irritant foods, okay? Excess intake of hot. Think again. Rakta is very similar to Pitta, okay? So so these are the times when if you completely turn blank, if your mind just goes blank, that's why I gave you that shortcut, okay? Exposure to sun, maybe you're a landscaper, or if you're a gardener, or that's just out of your hobby or your profession or whatever. If you work outdoors a lot, okay, not one day getting exposed to sun, that will just maybe increase your pitta that day. That's all. It's not going to affect your Rakta Dhatu to that extent. But if that's your job, okay, if you're there every day, okay, and any kind of occupational exposure, supposing you work in a forge, okay, you're a blacksmith, or you work in a forge, or you work in a place where the environment is very hot, Maybe somebody works in a factory where the conditions are not ideal. Okay. So anywhere where you're directly working near the fire, or you're a cook and you're always standing in front of, the flame, the high temperature burners and so on. Okay. And from an emotional side, excess worry, excess stress, excess anger. Okay. And this is another list that I found, which I found it in Dr. Lard's textbook. So I put that there also, because traditionally this list is what you will find. But these were also there, which I thought it's good to know. It's good to keep in mind. So the hot food, the spicy food, the salty food, the sour food. You see the connection? All these will also increase pitta. Okay. Nuts, certain nuts, peanuts, sesame, and all these in some way, shape, or form do have the capacity to vitiate our Rakta Dhatu. Okay. Because they depends on how much you take, they will cause your blood vessels to kind of dilate. Okay, and it will kind of bring in more blood. Sometimes it will make your blood vessels to constrict and reduce the blood flow. So it will have effects at the Rakta Dhatu level, at the Raktavaha srotas level, because it's affecting that channel, that blood vessel itself. Okay, so yes, anything that dilates that blood vessel or constricts that blood vessel, which all of these do. Supposing there's loss of blood, right? Somebody was in an accident and lost a lot of blood. Now that their Raktavaha srotas is immediately put under strain. Okay, immediately it is attacked. So it's like when you think of trauma, it all happens instantly, right? It's not like doesn't go through all the different stages of the samprapti of how disease occurs. Slowly, all the steps that occur slowly starts increasing in its own place. Then the container overflows. If you have not studied that, you will. So that this is step-by-step progression, and then finally you get disease. But trauma is not like that. It happens instantly, right? It's immediate. So the effects are more devastating because there's no time for the body to compensate. Okay. So that will immediately put, if you have a sudden loss of blood, it'll immediately put the Raktavaha srotas under strain. Okay. So deficiency of iron and vitamin B12, these will affect our the ability to form the Rakta Dhatu itself. Okay. And if you have specific infections of certain bacteria, certain microorganisms which are krimi, krimi means microorganisms and parasites and all that. Those can also affect our Raktavaha srotas. So this is another, for want of a better word, I'm going to say some of these are like modern list. Okay, that's not the official term. I'm just saying. Okay. Now, how do you assess the Raktavaha srotas? Where do you look for? I want to know the status of this person's Raktavaha srotas. Where are you going to look for it? Okay, these are some of the places that you can look for it. Some of these are accessible to you, so you can look at it with your eyes, your own eyes. Some of these you can't see with your own eyes. Okay, for example, you can see the skin of the person. You can see the skin of your client. You can see their cheeks. This is what I said, the rosy cheeks, right? Sometimes you can actually see they're not just rosy anymore, they're just red. Have you seen people with cheeks that are really red? And even, especially it's more obvious in a very light-skinned person. Now, that could be because at a skin level, okay, they have something going on in their skin, and therefore they have, that red cheeks, or it's something deeper. It's not just the skin. They have that extremely red cheeks. Okay, sometimes you also have red soles and palms. It's not the normal. It's not the normal pinkish kind of color, but it's very, very red. Yeah. Okay. So that's on your skin, your cheeks, your palms and soles. Those are good places to look for your the health of your Rakta Dhatu as well as the health of the Raktavaha srotas. Okay. This is something. Now I'm going to stop here just for a minute to remind you. The Raktavaha srotas are what? Those are srotas is the channel, and the Dhatu is the Rakta Dhatu, and the Dhatu actually circulates in the channel. Does that make sense? So there is the Dhatu, in this case, it's our Rakta. It is circulating in the Raktavaha srotas. I know this is kind of like what she's saying this for at this point. Keep in mind. So they're kind of inseparably linked. So when you're looking at the Raktavaha srotas, you're looking at the Rakta Dhatu because that's what's inside that. That's what it's, they're almost inseparable. Okay. So keep that in mind. So there's a lot of overlap. So another place that you can look for the health of the Raktavaha srotas is the conjunctiva. That's the eyelid. That's what Jyoti was mentioning in the chat, where sometimes doctors will pull down your lower eyelid and look there, and they'll tell you, oh, you're anemic or what or not. And modern doctors nowadays hardly touch the patient, so they don't do that anymore. The old timers still do, because now they don't even touch you if they can help it. Right, they'll just write a couple of blood work, and the blood work will tell whether you're anemic or not. No need to even touch the patient. That's what it's come to anyway. So yes, so when you can even look in the mirror, you can pull down your lower eyelid and you can look at that thing in the lower eyelid. And if the person's anemic, it will be quite pale. And if they have good amount of blood, it will be kind of pink or even red. Okay? Similarly with the tongue and the lips. Yeah. Oh yeah, Bonnie, yes, let's not even go there. We'll be here for 2 hours. The other things that you can look at too, like remember I told you about the tendons and the sinews. Sinews are actually more small, like, the types of tendons. So because why do you look at the blood vessels and the tendons, and how can you assess the Raktavaha srotas based on that? Because these are the 2 Upadhatus of Rakta Dhatu itself, right? You can look at something, or you can look at the it's whatever comes with it. Like, how they say, based on the company you keep, I can tell you see, and this, and those of you who have children, this, when you kind of criticize your child's friend, and then your child will be all up in arms, and then you'll say, oh, but people will look at the friend, and then if the friend is doing XYZ, they will think you're doing the XYZ too. Anybody remembers having this discussion with your child? It's kind of like that, okay? So by knowing the tendons and the sinews and the blood vessels, you can know the Rakta Dhatu, okay? That's another way to figure that out. So by the company it keeps almost. Liver and spleen. Now you can't see this with your eyes directly. So, but those are the places where these changes will be seen. That's what that means, okay? Now, what are okay, this is again repetition because we'll do this over and over again. What are the disorders that are possible? Now, disorders are possible in the Dhatu, in the Rakta Dhatu. Disorders can happen in the srotas or the channel. Okay, we did the similar thing in the Rasavaha srotas last week. So when you think of Rakta Dhatu, this is the actual blood that is circulating, the red portion of the blood. It can increase, Dhatu can increase, Dhatu can decrease, meaning too much Rakta, too little Rakta, Dushti, this is corrupted Rakta. Usually it is a dosha that has entered the Dhatu, okay? Srotas, this is the channel. Remember, we saw this last week. Too much flow, because think about it, this is not Dhatu, this is Srotas, meaning the channel. Something is happening to the entire highway network, okay? This is what has happened to the car that's going in the highway. This is the highway itself. Does that make sense? What is this and what is this? Yes? Okay. So these are the 4 things that can happen to that highway network. Too much flow, blockage. This is formation of like abscesses or tumors or, actually forming an outgrowth. This is false passage, last one. So ati pravriti, too much flow, sangha, stagnation, siragranthi, which is actually tumor or formation of any growth. Vimarga gamana is the formation of a false passage, okay? Meaning that's not the path it should take, but it breaks open some kind of barrier and takes another path, okay? The blood thinner actually does thin our blood, but that's not actually excess secretion from the root level itself. It's not like the liver and the spleen are secreting more rakta, right? That's not what is happening. Whatever is the rakta that is existing, this is kind of making it thinner. And when the doctors say thinner, it's not actually making it thin like a more dilute solution. That's not what it is. So it's not really thinner. If you actually looked at it, from a thickness or thinner, yes, it just doesn't clot as much. That's all. So it's the lack of clotting that makes, if you were to think clotting is thickening, then not clotting is thinning. Does that make sense? So it doesn't mean that their blood will actually be, thin. Yeah. Okay. So, Ati Pravriti is excess flow, Sangha is stagnation, Sira Granthi is, formation of nodules or tumors, whether they are malignant or benign tumors, anything that kind of forms like that. And this is false passage, Vimarka Gaman. This is over and over and over. You have to keep going through these names in your head. Okay. Let me see the, let me go here first. So very little Rakta Dhatu. This is this decreased Dhatu. Okay. Dry, pale skin, dull skin. There's not enough Dhatu. There's not enough Rakta Dhatu, right? So the blood vessels are not filled. They are kind of collapsed. And they desire more cold and sour food. Okay. Excess Dhatu, too much. This is kind of like, that's the blood red eyes, the bloodshot eyes. Sometimes the two red cheeks and palms. Sometimes it can have like any kind of bleeding from anywhere. It can also show up as skin disorders. Okay. Now I'm going to come to the srotas related, the 4 things. Remember, too much flow, very little, the sangha, which is the stagnation, the nodule or the tumor formation, and then the false passage. Okay. What does it look like in the Raktavaha srotas? Okay. Ati Pravriti for Raktavaha srotas. Too much flow in the Raktavaha srotas. What are some of those? So for us to understand, if there is too much flow in the highway of the Rakta, what will happen? Some examples. Hot flashes. There's too much hot blood flowing. Okay. High blood pressure. Blood pressure is a big chapter. It's got so many different types and all that stuff. But one example is high blood pressure. Red palms and hands. Remember, hands, even your soles, hot, flushed face. Sometimes these are all what you see when there is too much flow in our, which srotas, people? Which is the srotas we're talking about? Yes, thank you. So there's too much flow, okay? Sometimes it causes abnormal pulsations. Some people say they can feel like a pulsation in the center of their belly. Some people say they can feel pulsations in their neck and so on. Those abnormal pulsations could be a manifestation of there is ati pravriti, too much flow going on. Sometimes, again, this is that burning sensation because it has, what does Rakta do? It has the sensation of touch as well as the sensation of warmth, gives temperature, right? So too much flow there will be like you'll feel the skin is burning up, that internal or external burning sensation. Dermatographia, this is, sometimes when you, on some people's hands or whatever on their body, if you scratch or if you write the letter A, you can see the letter A form on their skin. Anybody has seen this in friends or clients or no? Okay, it comes in many under different circumstances too, but that's again one of those. Sangha is stagnation. So where do stagnant circulation, poor circulation, varicose veins, because that's just blood that is stagnating, right? Spider nevus, I don't know if you've seen this. These are like a spider. It'll look exactly like a spider, like blood vessels that will be branching off from a central part. Okay, that's again an example of stagnation. Sira Granthi, this is anything that's forming a growth or a collection, like a blood clot, right? And the blood clot sometimes forms and it breaks away and goes somewhere else. That's an embolism. Aneurysm, I'm sure you've heard, that's just basically an outgrowth of a blood vessel. So these are all some examples of when there is excess, a nodule or a growth or a clot or some kind of a mass-like thing forming. Is that making sense? Yeah, okay. Because it can be hard, I understand. So this is the false passage. For example, this is something breaking through and coming out because it's not supposed to come out. So any kind of bleeding that happens, that some barrier has been broken through, like a nosebleed. We all know there's blood everywhere, like blood is circulating all the time. It doesn't just come out. So when it's coming out as a nosebleed, that means it has breached, right? It has breached through some wall. Otherwise, how the blood that's supposed to be inside the blood vessel came out? So there has been a passage that has been, bored through, right? So any kind of bleeding that's coming out in a place where it should not be bleeding, like, your gums, even sometimes you see it in your eyes, blood in the urine, blood in the stools, anything. I don't know if any of you have had this. Sometimes you'll just have like a bleeding spot that has happened in the white portion of your eye. Has it happened to anybody? Suppose sometimes when you cough really violently, or children, sometimes they jump up and down on the bed. Yes, it kind of, the pressure increases to such an extent that it just kind of pop, it just bursts open. And it's very scary because, oh my God, there's like blood in the eye kind of a picture. And then that pressure has breached that blood vessel wall. Okay, that's a false passage. It shouldn't come out, but it did. So these are some of the protocols or herbs and so on, which is targeted for the Rasa Dhatu. And you'll read this more when you do Rasa Dhatu and the Rasavaha srotas themselves. Okay. So this first point is what I was going on and on about. Okay. So you have to tackle the Rasavaha srotas vitiation as if you're going to get, tackling the Rakta Dhatu and the Pitta. So normally, what is the treatment for Pitta? So usually, if you want to cleanse Pitta, it's vitiation, which is purgation. Okay. So, and Rakta Mokshana, that is bloodletting, which we don't do anymore. I mean, we can't do it. I mean, it's done. It's being done. I wouldn't say it's not done anymore. It's just we can't do it here. Okay. So kind of the approach is the same. That's why this is coming up over and over again. So Virechana Upavasa, this is fasting or some kind of Langana kind of therapy, fasting. And then there is a Rakta Mokshana or bloodletting, not relevant for us at this point. Okay. So excess Rakta Dhatu, too much Rakta Dhatu, Sariva is Chandana is sandal, basically. Too little, you have to build up the Rakta Dhatu. Things like this is pomegranate, Darima, and then Amlaki, So these are some of the herbs specific for the Raktavaha srotas to like Manjishta, Neem, turmeric, Chandana. There's a lot more, but I put the more familiar ones. And what are some of those things that give Rasayana? Rasayana means which are rejuvenating specifically for the Raktavaha srotas. And easily you can say it's Amlaki. Now, if you think, this is again like very Pitta related kind of things, if you see. So Raktavaha srotas, Pitta dosha. Rakta Dhatu, Pitta dosha. Keep that pairing going, and you won't be far wrong. Okay. Let me see. I think I've come in right on time. So, do you have any questions? I think I have a couple of minutes. Too much? I know it's too much. I shouldn't even ask. It is too much. But AC 105 is like that. Okay. It is a lot. It is you have to do your homework. You have to go home and read. Otherwise, you'll be lost in the woods. If there's nothing I can answer for you here, you can thank me for heating up your head. But you have to study it. There's no go, and it is one of the harder modules, AC 105. Okay. So I have been checking on Slack. I haven't seen any questions, but if you have any, do post them there. I do check it. Yeah. Oh, thank you. Yes, you need to go through the slides over and over again, read your textbook, read your handouts. Yes. This is how everybody learns. So, don't feel bad at all. This is one of those things. Thank you, everyone. Yes, it will. It absolutely will. But, it can drive you nuts also. So. Oh, that's okay. That's Dr. Lad's book. Textbook of Ayurveda. I'm just putting it in the chat. Oh, that was Dr. I mean, the slideshow, I updated it because it was an older one, and that was made by Dr. Kirti Pingle. So I just had to credit her. I know, because I used the material in her slides. I just updated the slideshow and added some information. Yeah. Yeah. So thank you, everyone, and hope you have a good rest of the week.